Hello, everyone. While everyone's hopping on, we're going to go ahead and get started. I want to welcome you to this session of the 2024 Culture of Data Conference. Thank you all for joining us today. My name is Samantha Bertoman, and I will be moderating this session. We also have Allison Rosenthal here, who is managing the Zoom and making sure that our tech is running smoothly. You all are currently muted, but if you have any questions during the Q&A sessions, please feel free to unmute. You can also use the chat box if you have any questions or need anything. If you're comfortable with doing so, please go ahead and add your pronouns to your Zoom name by clicking the three dots on your video square and selecting Rename. We have one presentation during today's session. They will be presenting for approximately 25 minutes, and then after there will be a 10-minute Q&A. I am personally excited to learn about advancing equity for Asian American, Native Hawaiian, and the Pacific Islander community. And so I will now turn it over to Kimberly Fu, Lindsay Whittington, Rachel Boyer, and Jean Suchia to present the Lotus Project, Harnessing Data and Storytelling to Advance Equity in Colorado's AANHPI community.
Thanks, Samantha, and thanks everyone for being here today for our session. I'm going to go ahead and share my screen here, and I'm excited to be here and share more on this first of its kind report for Asian Americans, Native Hawaiians, and other Pacific Islanders, also known as AANHPI, our community here in Colorado called the Colorado Lotus Project. So my name is Kimberly Fu, and I'm a research and analysis manager with the Colorado Health Institute. And I'm joined today by Jean Suchia, who is the co-chair of the Colorado AAPI Circle, our partners for this work, and Lindsay Whittington, who is a data and analysis manager here at CHI. While you'll be hearing from the three of us today, I want to take a moment to acknowledge that we are just three of many people who have been working to create the Colorado Lotus Project. So with that, I want to take a moment to acknowledge all of the individuals who have supported our work, from additional CHI and Circle team members to community leaders and advocates who joined our advisory group, partnered with us to carry out the work through facilitation, storytelling, artwork, and people who joined our interviews, our focus groups, our storytelling opportunities, and other community engagement efforts. So really big thank you to all of our partners and our community members who supported this work as well. Our objectives for today's presentation are to first take a look at disaggregated data on Colorado's AANHPI communities. So breaking apart the data beyond the categories of Asian and Native Hawaiian and other Pacific Islander, and really understanding why that data is needed to support more equitable allocation of resources. We also want to share our approaches for engaging with the community to elevate what's not being shown in that data and the lived experiences of people in the community. And finally, we want to share our lessons for advancing data disaggregation as well as community engagement to drive change. But first, before we do that, I'm going to pass it over to Jean to share more about the origin of this and why it's so needed for communities.
Hi, everyone. Thanks, Kimberly. My name is Jean Suchia. I'm the co-chair of the AAPI Circle. It's really awesome to be with you all today. Before turning it back to the CHI team to go through parts of this report and the process of how it was built on equitable principles, I wanted to share the really compelling origin story of both our Colorado AAPI Circle and how we came to partner with CHI on this amazing project. So first, our circle, think of it like a small donor-advised fund. We are a member-driven fund. We were only started a few years ago, and we are small but mighty and focused on really trying to democratize the philanthropic grant-making ventures within the AANHPI communities in Colorado. We did our first round of grant making a year ago, and we are gearing up for our second round of grant making this year, heavily informed by the report that you're going to learn a little bit more about today. I also want to acknowledge my co-chair, but also the founder of the circle through all of this, Christy Keolakai. What you will learn about over the course of this breakout session today was ultimately Christy's brainchild, in the sense that we all had this idea of the need to address what is being discussed today. She's the one that put it all in motion. And I also want to say that even before this Lotus Project became what it is about to become in the next few weeks, with the public launch happening in early May, we were very excited to work with CHI on an environmental scan prior to all of this, about a year and a half ago, just to even see what was possible. So the reason we wanted to do this is to answer the question of where our communities are and what they need. And the reason that we needed to answer this question is because it became painfully apparent from our own community leaders and service providers that they didn't know how to advocate for themselves, and they felt overlooked. So our founding of the circle was really in part to inspire this project, and it coincided with a number of really interesting external factors in the environment. First, COVID and anti-Asian hate was rampant, admittedly still happening, but particularly acute a number of years ago as the pandemic was in full swing. The 2020 US Census identified Asian Americans across the country as the fastest growing population, and that is also true in our state. There's also the Asian Americans and Pacific Islanders in Philanthropy, APIP for short, created what is called the Seeking to Soar report. This was an analysis of philanthropic funding across the nation, and specifically geared towards where investments were going to AAPI communities. This particular report identified 20 cents for every $100 across the country going to in philanthropic spend going to AANHPI communities. That's a national figure, and admittedly, the figure in Colorado is slightly higher, but only slightly. And then lastly, I just wanted to acknowledge that one of the other external factors for our ability to want to pull this off is the burgeoning advocacy community that's happening in Colorado's AAPI community as well. So with all of that in the background, we really searched for models across the country to help us pull off what we wanted to do here in Colorado. And we wanted to establish pathways to not only deeply engage with our own communities, but also invest within them and help them break free from this notion that the communities that we all come from in this state are somehow a monolith. So what we were able to do at what was essentially the model for us was this awesome report out of California called We the Resilient that examined the American Indian and Alaska Native populations with specific domains in which we could study from this report their needs and then apply similar learnings to the Lotus Project here in Colorado. So I want to acknowledge just how amazing this report was in serving as the sort of backbone for how we wanted to go about studying exactly not just the identification of where our communities were, but the identification of, through these domains, what they needed from a healthcare access perspective, or the housing disparities that they faced, or some of the economic opportunity barriers along the way. I also want to acknowledge that we think that this is a first of its kind report in Colorado. And we are, with both our AAPI Circle and the Lotus Project, we are trying to not only increase the opportunities for the AANHPI communities and populations to be heard and have a say, while simultaneously advancing for increased investment, dispelling the model minority myth, and clearly articulating the different experiences faced by Colorado's fastest growing populations. So we are not only super excited to partner with CHI on pulling this off and working with our communities, but we also sincerely and genuinely hope that this type of project and this type of report can not only live in perpetuity and serve as a sort of longitudinal basis for evidence and data collection for our communities in Colorado, but also for traditionally underserved communities in both our state and across the country, as well as communities who are seeking greater voice and representation in areas of civic engagement, for example. So again, I'm really happy to be here, and Kimberly, back to you.
Thanks so much, Jean. Thanks for providing that overview of how this all came to be. And this is really important work that we are really excited to dig into with you all today. So let's get into kind of how we set the stage for the Colorado Lotus Project. Our goal with this work was to uplift the voices and the experiences of AANHPI people living here in Colorado. And a big piece of that is not just uncovering the challenges that folks and communities are facing, also the strengths. And we wanted to make sure that we were doing that in a way that was authentic and meaningful and would be useful to the community members as well as community leaders. So we first needed to establish partnerships with subject matter experts and create a community advisory group. These folks partnered with us to drive each stage of our work of this project, which is broken into 3 stages: quantitative data analysis, community engagement and storytelling, and then synthesis and dissemination. So in phase 1, our guiding questions were, where do AANHPI people in Colorado live? So we need to understand where in the state folks are living, where there's highest concentration of communities, but also who those communities are. What are the different identities under Asian and Native Hawaiian Pacific Islander are living in the state? What languages are represented? And that really helps us set a foundation for making sure we have the right resources and equitable access to those services for communities. Our second question was to look more closely at that philanthropic funding and what that value looks like for Colorado's AANHPI communities compared to that national figure that Jean mentioned. And the third question in this stage is, what data are available on communities to begin with, and what metrics should we disaggregate, or are we able to disaggregate? The guiding questions for phase 2 is what's being shown in the data and what's not being shown. So really trying to understand the actual people and the stories behind the data with an acknowledgement that quantitative data can't paint the full story for us. And then finally, the guiding questions in phase 3 were what's needed to improve data collection and to address the needs of the communities, and how can we best share our findings out with the community members who partnered with us, but also with policymakers, with funders and service providers and advocates. So what did that all really look like in practice, and what were the outcomes of our work? Well, first we had 10 AANHPI leaders serve in an advisory group with us, and then we also partnered with additional community members and advocates to provide subject matter expertise and to work with us through each phase of this project. Our goal here was really to be inclusive through each stage, not just to guide and inform the research, but to help us carry out this work, to outreach to the community, to facilitate our focus groups in partnership with us, to write stories, and to create art that we all were able to include into our final report. So once we had this group established, we were able to start with our first phase of work, which again was quantitative data analysis. So what we were able to do here is to create a population map of where people are living across the state by disaggregated identity. Our team also conducted a philanthropic analysis using the same methods as APIP's report that Jean mentioned to understand what foundation funding looks like for Colorado compared to that national figure. And we also conducted a literature review and environmental scan to see what data metrics were available and what information was available on the community across the 7 domain areas that Jean mentioned before, inspired by that We the Resilient report. So we compiled our findings into a data metric inventory, and then we worked with our community partners to identify which metrics were going to be the most important and useful to see at a disaggregated identity level. So again, really leaning on community partners to understand what data is missing and what's going to be needed to help advocate for the community. Ultimately, we were able to feature 30 metrics in our final report. I'll note that those also have like varying levels of disaggregation just because of the sources that data is all coming from. All of that information informed phase 2, which again is community engagement and storytelling. So we spoke with 12 subject matter experts about the data we were seeing or lack thereof. We also reached out to the community in 2 ways. We first conducted a thought exchange, which is an online poll, and we asked folks to share their comments broadly on what they thought the strengths and barriers are facing AANHPI people here in Colorado. That thought exchange allows them to review the comments of others as well and rate their agreements with their comments. Overall, we had 107 people participate in the thought exchange and collected 60 comments. We also had 51 community members participate in 6 focus groups that we hosted to better understand those lived experiences. So we categorized those 6 groups, 4 by AANHPI regional identity, so East Asian, South Asian, Southeast Asian, and Native Hawaiian and Pacific Islander. And then the remaining 2 were prioritized by intersecting identities that we determined in partnership with our advisory group. So that was AANHPI recent immigrants and refugees and AANHPI youth. And then finally, to help kind of highlight the strength and the resiliency, but also the challenges of the community, we engaged in 5 storytelling profiles to weave in narrative to our quantitative findings and provide a deeper look at the people behind the numbers. And then in that final stage of work, we focused on recommendations and what's needed and really how to share that back out with folks. Again, a really broad audience of the community members, but also philanthropic, government, community-based partners. So we created a final report to reflect all that rich information we were able to capture. And one thing I want to highlight too is that we also partnered with an AANHPI artist to create cover art to reflect that strength and resilience of the community to create a really beautiful piece for our report. Our team also created an executive summary, 7 fact sheets, and a community flyer that's translated into 7 AANHPI languages to share back with community members. And so to note, our team is currently wrapping up this stage now, and the full materials and everything is going to be available in about 3 weeks. So today we are going to preview the interactive maps that we built and also highlight a couple disaggregated metrics and community voices that we heard. So with that, I will pass it to Lindsay to dig more into the findings.
Thanks, Kimberly. So like we previously mentioned, we investigated and gathered many different metrics from a whole host of different available data sources by our 7 domains that we mentioned earlier. And an important finding of these data sources is that they are not all disaggregating data in the same manner. Data collection and reporting improvements are needed across all systems to help with both representation within the data and also comparability across those different systems. Getting data that is relevant to the community that live in our state and to say something meaningful is of the utmost importance. So something that we really wanted to raise is the importance of data equity considerations of this work. How are we presenting this data? What are the unintended consequences? What are we trying to say with these data? These are all very important considerations. So first, how do we present the data? For example, it is important to consider sample sizes and reportability while also balancing disaggregation methods. We are referring to different AANHPI identities, but also need to be transparent where we aren't able to pull data for specific identities. We don't want to make any community feel invisible. The point of this work is to uplift community and to have them feel seen in the numbers. Second, what are the unintended consequences? We also want to highlight variations in the data as there's variation within the AANHPI category itself. We should compare values to the AANHPI or the Colorado average overall, not necessarily make comparisons between our different identities, as we don't want to create unintended harm. Along those lines, we want to protect the community from unintended harm. For example, we've locked access to the maps and are asking folks to request access to those because data are represented at the census tract level, which I will share with you shortly as well. And lastly, what are we trying to say with these data? The data that we are presenting on today are based on available census data. And while it's not perfect, it's not the ultimate authority on how communities identify. They are also making improvements by really focusing on making more disaggregated data available. This speaks to the importance of having information on all the unique people that live in Colorado, understanding their experiences, and being able to have a greater impact on policy changes and other programmatic opportunities. So now let's go through a couple examples of the different data products that we have created for this project. All right, so Kimberly, if you can unshare, I'll share the maps. All right, sweet. Okay, so we're just going to walk through one of the data products that Kimberly mentioned earlier, and this is the AANHPI community mapping tool, which again is locked for access to help protect against unintended consequences for communities across Colorado. So we created this tool so that individuals like different community groups and others can actually understand where distinct populations within the AANHPI community live in Colorado, where there is individuals, where are their density areas for different populations. So this map is organized by both Asian ethnicities as well as Native Hawaiian or other Pacific Islander ethnicities. And the user is able to look at different populations across Colorado by clicking on the different selection tools, as well as able to search different areas that you might be interested in. So if you're interested in areas like maybe south of Denver, you can actually either zoom in or search specific locations that you're interested in looking at to see within your community, where are AANHPI community members more likely to live. And this can help with different outreach efforts and other ways that community groups can engage with these individuals. So this map also just includes counts. So you'll see that when you use the drop-down menu for a given layer, you're able to see the density of that population and where that population lives by darkest blue, meaning more individuals, and lighter blue being less individuals in that area. So a very important tool that was identified early on where many individuals just didn't know where populations of interest live. So this is an easy way that people can help find where their community might live and do a little bit of outreach for those individuals. All right, I'll stop sharing, then we'll go back to the presentation. All right. So as mentioned previously, our data are framed around 7 domains that Jean pointed out earlier on in the presentation. Our first example that we're going to look at is from our housing domain. So here we have an example of the kinds of things that we heard from community members that we engage. This participant was from the recent immigrant and refugee focus group that was conducted. So they said, I have a job, but everything is more expensive after the pandemic. Housing, food, but your pay is not enough. Food costs double, but your salary doesn't double. Housing is the most expensive. So while the data is incredibly important, framing with community voice and understanding perspectives of the community are also equally important. So now let's look at one of our data metrics. So for housing, this first metric is looking at the percentage of people in Colorado of all ages that experience housing cost burden. And this represents individuals that pay 30% or more of their income on housing related costs every month. So here at the first 3 bars that we see here, this is the kind of information that is typically made available in many reports. Sometimes even Asian and Native Hawaiian and other Pacific Islander are also aggregated further. But it is important to note here that in all of our figures, we are still noting the communities that we gathered information on that are unable to report reliable estimates. So let's show what it looks like when we actually disaggregate data. So here we can see that there is a lot of variation within the AANHPI community. This kind of information and this kind of specificity and granularity can really help improve policy and frame the conversation more meaningfully around these distinct communities that call Colorado home. So again, I wanted to also say that the identities that we're not able to show because of sample size is Fijian, Marshallese, Okinawan, and Tongan. Just want to make sure everybody knows that there is no invisibility in the kinds of things that we're reporting on. So our next example is from our income and economic opportunity domain. And this participant was from the East Asian Identifying Focus Group that was conducted. And they said, I have a master's degree and work full time, and I still have to do another job to get what my family needs. Again, this is further highlighting the importance of community engagement to help frame and put context to the data and information that we are gathering and uplift this lived experience. Without it, many of these data points are just naked numbers. So for this second example, we're looking at the percentage of people in Colorado who are earning incomes at or below 200% of the federal poverty level. Again, we see just our three overall populations, which are normally presented on the Colorado, Asian, and Native Hawaiian and other Pacific Islander population. So again, when we disaggregate this, we really see the real story and how it unfolds, as there is so much variation within this unique community. And again, it is important to note here that the Fijian, Marshallese, Okinawan, and Tongan populations we were unable to disaggregate for. But again, really highlighting this rich community and how when we disaggregate, really understanding what it means and further putting this into perspective for policy and other programmatic efforts.
Thanks, Lindsay. That's just 2 data points of what we were able to share. As mentioned in our full report, we have 3 figures that we were able to include, but I hope this is just a show of just how much data has been missing and all the information that has really been kind of hidden by not disaggregating data. And that really has been long overdue for AANHPI and also other communities too. So with that, though, in our last few minutes here, we want to share the lessons that we've learned in doing this work back with you. The first is that data are publicly available, and this might not be something a lot of folks know, but all that data that Lindsay, those 2 data points, as well as the maps were created from data available in the Census Bureau. So at that disaggregated level, it's available, and we really need to disaggregate it to begin to understand the nuances in experiences and identities. But with that said, as Lindsay mentioned, improvements to data collection are really needed, as well as reporting systems. And we all really have a role in that work, whether it's advocating for improvements, but also making sure that we're aligned with other data sources, with an acknowledgement that we also need to be nimble, right? Identity can change, how we categorize things can change, and even in, what we were able to capture, there are other ethnicity groups that are not even reflected in that information either. So thinking about how that changes over time, but also thinking about things like intersecting identities and understanding how experiences are going to differ based off of other characteristics, such as people who are LGBTQ+, or people who are immigrants and refugees, along with other characteristics. Third is that inclusivity needs to happen across the board in this type of work. From research and sharing out findings, we have to be community driven, centered, and led. And by partnering with people in the community, we can make sure that we're doing this work together and not just for communities. And that makes sure that the findings are relevant and useful. But that engagement must also be authentic and responsive. And that means, again, being nimble to shift our approaches so that we can reach the community and we can reach people where they are. And again, partnering with trusted community leaders helps with that outreach as well. And finally, the Colorado Lotus Project is just one push forward for AANHPI advocacy efforts in our state and nationwide. Not only is more work needed, but we also hope that this is just the beginning of more work to come for our community as well as others. We hope that this process will kind of serve as a blueprint for other communities of color to raise their experiences too, as Jean mentioned. We recognize that it is needed for other groups, and we hope that this is the starting point for them and also for our community too, to keep pushing and build this momentum moving forward. So with that, as I mentioned earlier, our full findings and full report will be launched on May 8th. So that's the final report, fact sheets, 2-page flyers about how you can get involved in the work and to share out with folks. If you do visit our website today at this link here on your screen, you can access the interactive map that Lindsay previewed, as well as the data metric inventory. But again, really just thank you to everyone for being here today. And if you're interested in contacting or learning more about the Circle, you can reach out to them at coaapicircle@gmail.com. And if you want to learn more about the Lotus Project and the data, you can reach the Colorado Health Institute team at lotus@coloradohealthinstitute.org. So with that, I will turn it over for questions. And I do also have one more thing too. We are going to actually launch, as I mentioned, the Colorado Lotus Project in about 3 weeks. A part of that is going to be a live stream webinar. So if folks are interested in joining that, I've just went ahead and put the registration link in the chat where you can join us for some more findings and information on May 8th.
Awesome. Thank you all. So please feel free to put your questions in the chat, or feel free to come off mute and ask a question.
Samantha, I have a question. Yeah, thank you so much for this presentation today. I was just wondering if you guys could talk a little bit more about what data sources are available to look at like philanthropic giving in Colorado and like how people can make use of this data.
Yeah, absolutely. Rachel, who's on the line, did our philanthropic analysis. So I'm going to invite Rachel, who is behind the scenes supporting our presentation today, but very integral to this work, to share more about our philanthropic analysis portion.
Yeah, absolutely. Yeah. So to get to like kind of the key finding first, there is a lack of consolidated information about philanthropic giving kind of overall, and specifically about, you know, where these philanthropic dollars are ending up. And so when we did our philanthropic analysis, we looked at a source called Candid, which is kind of like this source where you can, philanthropies and foundations can kind of self-report their giving and kind of identify who their dollars are reaching. And we found that, you know, only 60 cents of every $100 in Colorado are designated specifically for AANHPI communities. And so, you know, that could mean a couple things. I think, you know, number one, it shows that, you know, maybe there aren't a lot of, there historically hasn't been a lot of funding for AANHPI communities in Colorado, you know, partially because we have this disaggregation issue and this model minority myth where, you know, it seems like AANHPI communities are doing well. But we know when we dive into the data that, you know, that's not the full story. And secondly, could also be, you know, a lack of funders really being transparent and telling people, you know, this is where our dollars are ending up, you know, in a way that's easily accessible to, you know, public health or any kind of other organization or area that wants to look at this philanthropic analysis with the lens of, you know, benefiting specific communities. So our sources are primarily from Candid, but I think we also, you know, we very much also call in our report for better reporting from philanthropy and a better understanding of really this whole philanthropic landscape.
Thanks, Rachel. And I will add to that too. Similar to the data that we shared today, in addition to like the identities that couldn't be included due to small sample sizes, we also included the source of the data on every single graphic and every single figure that's in the report. That includes for the philanthropic analysis too. So a lot of that came from Candid, as Rachel mentioned. But one thing that's clear throughout all of this work is just that need for better data collection and transparency in all of the sectors and systems that we're digging into. Thanks for the question, and thanks, Rachel.
I just want to recognize that there's a comment in the chat. I'm happy to read it if.
Oh yeah, do you want to read it for the recording, Samantha?
Yeah, that's a good, yeah. So it says, I lived in Cambodia from 2015 to 2020, and although not specific to Colorado, there was a significant amount of people who were deported from the US, where they grew up, to Cambodia, where they had never been. It would be interesting to see data on how many people from these communities are directly/indirectly affected. Looking forward to the report. Great presentation and amazing work. Thank you, Shanna.
Oh yeah, I have another question for you guys if you are up for it. Yeah, and I really loved how you guys paired the census analysis with this work, and it was just really cool to see where people are living. It's a very powerful like graphic. I guess I'm just wondering if you guys included data on what primary languages people are speaking in different parts of Colorado. I know like this would just be really helpful information for us in our work and just figuring out like what languages we need to translate our reports in, or kind of pay attention to like language needs. I don't know if you guys explored that issue.
Yeah, thanks for the question, Allison. Our report does have some information about the languages that are spoken in our state and how many people speak those languages. And I believe, Lindsay, we did not take that one step further yet. And I say yet because hopefully this is something that we can continue of like cross-tabbing where those languages are across regions of the state. Again, a lot of that is just an acknowledgement that there's just so much in this first round of work that we hope that we wanted to dig into and that we wanted to uncover. But hopefully in the future, that's something else that we will be able to dig into a little more deeply, is looking at some of those metrics kind of cross-tabbed with geography, for example, or other factors. Thanks for that question, Allison. And of course, welcome Lindsay or Rachel to dig in more into that answer too, because I know you both were very close with that data.
Yeah, I think that's such an important part of this, because when we think about the AANHPI community, just the communities itself, there's so much variation. But when we think about just the number of language groups that exist within this population, and the kind of the relationship between language access, when we talk about people trying to access healthcare, when we're trying to go to the doctor's office, and availability of translators and interpreters in specific dialects, the likelihood that community has more likely to also speak English. There's just such an important dynamic when we talk about language, I think, for the AANHPI community, because there's so many different language dialects. Even within a country itself, we know that there's going to be hundreds of other regional dialects as well. I just think there's such a big part of it that's also related to language justice and language access for this population. Thank you for mentioning that.
Yeah, and to kind of like, continue a theme of like, really getting a lot of insights from our focus groups and our community engagement. Mm-hmm. We also heard that, quality of translation and interpretation is extremely important. We got a lot of feedback from people who have utilized interpretation or translation that, at many times the quality can be lacking. So I think that's something very important to keep in mind as well, that, it's simply not enough to offer, languages or services, but there also has to be a real commitment to providing quality services as well.
We have time for like probably one or two more questions. If anyone wants to pop off mute or put them in the chat. I do also want to acknowledge that Karam mentioned in the chat, in reference to what Shanna had previously put in the chat. Karam said, our report acknowledges migration, dynamics, challenges, and lived experiences. That's a great example to flag, one of so many stories from the dozens of communities represented. All right, well, if anyone has any other questions, feel free to put them in the chat. I'm gonna just do a quick thank you for attending this session and for engaging in the question and answer part of the session. A few short announcements before you do head out. Slides and any additional handouts the speakers have provided are available on Sched. So, and then you will receive a conference evaluation form via email after the conference is over. Please go ahead and fill that out, even if you only attended a portion of the conference. It is really helpful for our planning committee. There will be a raffle for everyone who completes the survey within 2 weeks, and you could win one of two $50 gift cards. So please go ahead and fill that out. Thank you, everyone.